Figuring out where perimenopause ends and menopause begins when you have an IUD and you're not bleeding can be tricky. The IUD suppresses endometrial bleeding, which menopause is when you're not bleeding anymore. So you were just started on estrogen, you're in perimenopause now. You need around 51 is average age of menopause. If you really wanted to find out this answer at any point, you could come off your estrogen for about 6 weeks and have your provider do a FSH and see what the number is. If your FSH is in that postmenopausal range, then you're menopausal. If you'd prefer to not come off your estrogen, which I would understand, you can interpret the FSH and the estrogen level that you're getting every so often. So with my patients, I check their labs about twice a year. So I'm getting numbers constantly. Someone who's in perimenopause, what I see in my clinical experience is if they're in perimenopause and they're on an estrogen, their estrogen will go from maybe 40 to 20, but then the next time I check it, it's 100, 200. So it's all over the place. And their FSH is like 15, 20s when they're on the estrogen. When they're in menopause, estrogen labs are pretty steady. You're 20, 30, 40, 50, depending on it just varies. It very much correlates with my dose that I put you on. And then your FSH is usually higher, even with estrogen replacement. So if you have steady estrogen levels and no fluctuations, if you're getting them done pretty regularly, then it's more likely that you're in menopause. As far as when you stop taking this, that's up to you. Estrogen therapy obviously helps for the very highly symptomatic time of perimenopause. It helps blunt the highs and lows of the estrogen fluctuation, and it just makes you feel better. For menopause, when your hormones are low and you're not having those fluctuations, you're usually a little less symptomatic, but not asymptomatic. There's other things that go with it. But the biggest concern I have there is longevity. So we know estrogen, when started appropriately, reduces your risk of cognitive decline, osteoporotic fracture, and heart disease. So when I start estrogen, when that happens, I'm not in perimenopause yet, but when I do, I assume I'm going to take it for as long as I feel good on it, and I want to take it, and I don't have any contraindications. So you have to take the estrogen to get the benefit from it. You can't, if you're not on it, you don't get the benefit. And the benefit usually during perimenopause is symptom management, and then menopause is a little less symptom management, but it's still like it helps with lubrication, dryness, hair, mood, energy, those kinds of things, bone health, but then it's more of like preventative bone, heart, brain. So I hope that was helpful. Ask your provider to get some labs. If you really want to know, come off estrogen, see where your labs are. We basically assume that once you're 55, then you're likely in menopause, but confirm with labs and your symptoms too. If you feel like you're feeling more stable, levels aren't up and down, then you might be in menopause. But I'm sorry, it's a moving target when you have IUD that stops bleeding.